We're going to discuss about today RFTs, which stands for Renal Function Test, also known as KFTs, which is an acronym for Kidney Function Test. Kidneys are naturally responsible for the filtration of blood and excretion of its waste products, which includes urea, uric acid, etc. The phenomenon of filtration is processed by the glomerular part of nephron, which is the functional unit of kidney. A selective amount of blood passes through the kidneys, and their filtration is done by the glomerulus. Many products like useful proteins are reabsorbed into the blood, and others are excreted through the urine by the normal metabolism. Parameters of renal function tests. First of all, we have urea, which is a waste product results in the lysis or breakdown of proteins in the liver. Kidneys filter it out of blood into urine, and its normal range is 6 to 24 mg per deciliter. Then creatinine is a byproduct of your muscles and occurs as a chemical waste later, which is filtered out from the blood by the kidneys, and its normal range lies between 0.7 and 1.3 mg per deciliter. Then uric acid. When purine's breakdown occurs in the human body, uric acid is produced with the reference range 3.5 to 7.2 mg per deciliter. Excess of uric acid gets accumulated in the joints and causes joint pain and stiffness, etc. Then we have GFR in the last. The small filters in the glomerulus, termed as glomeruli, are responsible for the removal of excess fluid and waste. Glomerular filtration rate is an actual measurement of how much blood passes through the glomeruli per minute. It is helpful for indicating the stages of kidney diseases if lower than normal, 90 to 120 milliliter per minute. If we talk about the specimen required for the renal function test, serum is the most recommended specimen obtained after the centrifugation of whole blood for 3 to 5 minutes at an optimum speed. Principle and procedures. Urea. Principle. In the presence of urease enzyme, urea is hydrolyzed into ammonia and carbon dioxide. The ammonia produced comes in reaction with alpha-ketoglutarate to form glutamate in the presence of NADH. NADH is oxidized, resulting in the decrease in absorbance at 340 nanometer, that is directly proportional to the concentration of urea in the sample. Procedure. R1 is equal to 400 microliter, R2 is equal to 100 micro per liter, and serum is equal to 10 micro per liter. Creatinine principle. Creatinine reaction with picric acid results in the formation of orange color compound known as creatinine picrate complex in an alkaline medium, which is directly proportional to the concentration of creatinine in the sample. The whole reaction is called Jeff's reaction, and the rate of increase in absorbance is measured at the wavelength of 500 nanometer. Procedure. R1 is required in 250 microliter, R2 is also required in 250 microliters, and serum is required in 50 microliter amounts. Uric acid principle. Uric acid plus water plus oxygen will give us allantoin plus carbon dioxide plus hydrogen peroxide in the presence of uricase. The hydrogen peroxide produced gives red color when reacts with chromogen in the presence of peroxidase enzyme. The intensity of that red color is proportional to the amount of uric acid in the sample. In procedure, reagent is required in 500 microliters and serum is required in 10 microliter amounts. Incubation is done before testing for uric acid. Then we have GFR in the last. Glomerular filtration rate is determined by the clearance of two types of markers which are filtered inside the kidneys by glomerulus, which are serum creatinine and cystatin C. Cystatin C is a type of protein formed by your body cells and carry low molecular weight. That's how we can perform the renal function test and assess the patient's kidney diseases.